Welcome to the APAP podcast live from the 2025 second annual conference. Today with me, I have Brian Bizik and I have Miss Amanda Michaud. I always mess up your last name. Did I do it right this time?
You did a good job.
Oh, good.
Yeah.
Okay, yes. I've gone through a lot
Pretty
of
close.
variations of your name over the years. You think I'd get it right by now, but
progress.
so we're going to talk a little bit about Brian and Amanda's sessions here at APAP 2025. And again, I'm so glad you guys came back. You were with us last year and did sessions. We had rave reviews, so I'm so glad that you came this year. Amanda, we'll start with your session. So you have a couple sessions this year: Immunology of the Lung 101, Chasing Zebras, and Finding the Zebras is 101.
Zebras.
Yep.
And then 102 is Chasing the Zebras.
The zebras.
Which zebras are referring to the patients with rare conditions called primary immune deficiency. So my sessions were mainly focusing on the red flags and things that stand out and how to better recognize these patients because they often go undiagnosed for a very long time. And then ultimately how we manage them in the immunology clinic.
Yeah, and I walked by your session. I think our sessions were at the same time. I really wanted to attend yours because we do see those patients, and oftentimes we're thinking, what is this? Like this seems like something else, right? And something's not right about those patients. And it looked very highly attended. And I saw people mobbing you as you were outside the room as well. So it sounds like they had a lot of questions. And
yeah, and a lot of the questions were on that note where, hey, I treat a lot of interstitial lung disease, but sometimes I just see these patients that get sick all the time, but I just know it's not their ILD. It's just different. And so a lot of questions about that. And not that, pulmonology PAs or NPs can't diagnose it. It's just, it's not always top of mind when you're seeing these patients for their regular follow-up or a sick visit or acute visit or whatever. So we really just drove home how important it is to be looking for these things. And lots of great questions, and the audience was like really engaged. So
I've been impressed with that.
It was awesome. Yeah.
Yeah, they've been great. All right. And Brian, your session was Gold Updates, which we all need because not all of us get to be as fancy as you and attend Gold.
That's
the Gold
right.
meeting.
I know.
Yeah.
It's great. I mean, Gold gets to update every year, and they do it every year at the end of the year, and they always have new things. And immunology in the lungs has been fascinating the last few years. And for so long, we had great therapies in asthma and we were making strides. And the last few years, we've seen that transition very well to the COPD world. And so looking at patients with COPD, asking questions about, hey, is there a biomarker I can look at? Is there a decision I need to make looking at a CBC that I maybe didn't make a couple of years ago? And Gold highlights that. They make a big point of what things are available and when to consider inhaled corticosteroids and when not, based on biomarkers and the patient in front of you and not just kind of, guessing anymore. So it's been a fun time to be and looking forward to Gold this year and seeing what else is coming out.
One thing I like about our conference, and one of my biggest goals of putting together a conference just for APPs, taught by APPs, was one, that you're among your peers to learn, which I think is great. And you guys are experts in your area, so I appreciate you guys being here. And the other was to make it very applicable to practice. You could take this information and it's not so high level that you now have to think about it and prophesize on it and everything else. You could really take this information and copy paste it into your practice. So Amanda, starting with you, what do you think out of your session was the big takeaway that somebody could go straight to their practice and start implementing?
I think the top takeaway was to not be afraid to initiate the workup and not be afraid to discuss with your patient or be freaked out by thinking about a possible immune deficiency, because I think it's overwhelming and we certainly just scratched the surface. Even tomorrow, which gets a little bit more in depth, it's still really scratching the surface. But these patients are in all of our clinics. We in the immunology clinic even miss some patient presentations that, end up having immune deficiency. And the biggest thing I think from like really bench to bedside that the audience would take home is, when to do the workup and what to start with, and how in the immunology clinic, even if you're not sure, if it even comes through a little thought through your mind that this patient might have immune deficiency, maybe I should check labs, just do it or send it to us. And we are more than willing to see those patients. So I think that was the biggest thing, just red flag, warning signs. And then of course, tomorrow's talk gets a lot more in depth when we talk about chasing the zebras, where we can look at the effects of IgG replacement on lung function and, the different pulmonary complications specifically. But, yeah, I think just knowing when to work up these patients and how to start it.
And Brian, for your session, what were the key takeaways that they could just apply to their practice right away?
Yeah, and what's great about GOLD guidelines and some of the changes is these are things you can do on Monday in the clinic. Hope maybe you don't have to work Monday, Tuesday when you get back. But if you're, a lot of the people here are in pulmonary medicine, so they're doing this already. But if you're not, or if you see COPD patients and it's not something you're comfortable with, the main goal of looking at immunology in the lungs is asking whether or not an inhaled corticosteroid daily is going to help your patient more or not. There's good things that come with inhaled steroid, and there's some negatives. And how do you ask that question based on a biomarker? Can I somewhat determine if an inhaled steroid makes sense or not for my patients? And if you have one thing you can do, look at that CBC, look at that eosinophil count, and there's different numbers, but if you can remember 200, because generally the benefits of an inhaled corticosteroid are going to outweigh the negatives. And below that, generally, again, it's not everybody, there's going to be kind of more negatives than positives. So what GOLD is saying is if they look like, if they're on a LAMA-LABA and they're still exacerbating and their eosinophils are higher, move them over to a triple inhaler or make some combination so you can get that inhaled steroid in. If they're much lower, then you want to either put that off for a while or reconsider or look at other therapies. And so hopefully that is something people can do, on Monday, start looking at that even before you go in the room and kind of know what you're up against.
Perfect. All right. So I know those that couldn't attend the conference, could you give them maybe a little teaser of a case that you guys did in your sessions just to give them a little flavor of what your session looked like? So Amanda, do you want to start with?
Yeah, I actually had presented a slide with the title, "Have you seen this patient?" And it literally went through 10 different little one-liners of the patients that over the last probably 18 months that we diagnosed with an immune deficiency. And you could see everyone in the room. There was maybe one or two obvious ones that everyone, I think, would be like, wow, that's definitely something going on there. But you could see everyone in the room was like, wait a minute, I see these patients. And that was the whole point, is to illustrate, hey, these patients are walking into all of our clinics and we need to be better about recognizing them. So we went through all these different cases. I gave a very recent one that was the last bullet point on that slide of a 46-year-old woman who had severe asthma and was just getting recurrent thrush. That was how her primary antibody deficiency, common variable immune deficiency, first presented. And initially for the last 6 months, we've tried everything, spacer, nebulized corticosteroids. She's now on a biologic, and it kept happening despite not being on any inhaled steroids. And then that sent off the red flags that there's something going on here. So we went through some little mini cases like that just to illustrate that point.
Oh yeah, we see those all the time. I mean, I know even with your COPD patients also, we're just like, oh, you're just doing it wrong. You're not really doing the oral hygiene. Unfortunately, we put a lot of blame on the patients, right? That it's not, it just must be they're doing something wrong or.
Right, and I just had that hunch, right? Sometimes clinical medicine, right, is just that hunch. And I just said, you know what? Let me get my warm fuzzies and just feel good that the fact that I checked you for this, it's going to be normal. And sure enough, it was not. And so
follow your gut.
Yeah. So it was just and the patient is doing amazing now on IVIG replacement therapy. So
perfect.
Yeah.
Perfect. All right. Did you use any cases in your?
Yeah. Well, I cheated because I had a patient that has COPD and diagnosis for a few years, but when I was talking to him, I did an intake, and then the second time I came back, I was talking more about his childhood, and sure enough, I was diagnosed with asthma, and I hadn't got that on the first time, and I should have, and so it was and so all of a sudden it brings in this idea of those things that we think about with asthma, trigger control and allergic triggers, and some of those other things that we don't always consider for COPD, that became very relevant for him, and also just there's a whole new kind of thing that we unlocked the achievement of considering things like biologic therapy for COPD now that we have a couple of different approved medications. So once that comes up and you think, okay, there's this possibility, at least some overlap or asthmatic features in a patient with diagnosed COPD, new options came up. So I cheated because it was a great patient, but it was real. So that was good.
It is real because a lot of times we don't know what to do with those patients that we consider overlap. And I don't think we screen for them as much. And then also GOLD made a big statement about there's asthma, there's COPD, there's patients who have both, but it's not really one syndrome. I know you and I have gone round and round about that as well in another podcast. So.
Right. Yeah. It's not a clinical entity into of itself, but you need to consider everything. And I would just say if you're considering both, then all treatment options are available for both generally. And so it doesn't restrict you at all. It opens up pretty much all the therapies that we have available to both disease states.
All right. Well, if you guys had to give a reason why people should attend the conference next year, what would you tell them?
I just think this is such an amazing meeting. I was just telling you before we got on here, it's an incredible conference. I learned so much, even though a lot of the things that are presented aren't really in my scope of practice, but we see all of these patients and we all actively share all of these patients. So, it's just an incredible meeting with lots of good lectures and really clinically relevant content. And that's more than one word. Sorry.
Well, and if you have a chance to come, in fact, you need to come. I don't care if you can't make it, still come, because this is a meeting where, unlike chest and some other ones that are amazing but just very big, you're not going to get lost here. You're going to learn and connect both in ways that you can't even imagine, and you'll go home with more tips and pearls and things, but also more friends than you thought possible. And those two things just make it very well worth it.
It does. Well, hopefully you guys will join us again next year for some other sessions. And thank you for listening to the APOP podcast. Please like, subscribe, follow us. It's the best way to support the organization. And don't forget to check out our social media pages as well as the website for CME opportunities.